Physicians, let's go back to your why. You are thinking about starting concierge medicine because you're burnt out. You're tired of hearing the stories about Medicare or the insurance companies dropping your reimbursement rates while you're seeing so many patients. You're tired, you're overworked, you don't even know if you want to do medicine anymore. And concierge medicine is your one chance to control your life. So you're hoping to get some strategies or some direction, but you don't know where to turn. Every time you talk to a friend or you read something online, it's different information and it's more confusing than ever. You're thinking maybe you're just gonna have to give up entirely and just do regular traditional medicine. But you have a little glimmer of hope thinking that maybe, just maybe, you too can leave the rat race. Hi, I'm attorney Doris DK, and here at DK Law Group, I've been working with providers and healthcare entrepreneurs to achieve their professional dreams. I am a practicing attorney in Dallas, Texas, and I've been practicing working with healthcare providers and entrepreneurs, whether it's drafting contracts, helping them starting concierge businesses, helping with regulatory compliance, healthcare startups, physician and employee disputes, you name it, in healthcare business law, we've done it. And today, this video is going to be about concierge physician practices. Now, there are a lot of providers interested in concierge business model because they want a way out of traditional medicine. And there is a way out. Now, there are three options really for providers when they're considering concierge medicine. The first option is to not take insurance at all. That means you don't take Medicare, you don't take any private pay insurance, you don't take any insurance at all, and you have a traditional cash-based practice. That's a great opportunity for you to have some type of annual prescription model or a monthly prescription model that you bill your patients and they pay you and you have a consistent revenue source. The problem with this model sometimes is that a lot of your patients do have insurance and they want to be able to see the other providers that they're utilizing in their insurance model and not pay an additional fee to you. Now, it might work for you if your fees are relatively cheap, but if a provider or a patient rather has to pay several hundreds of dollars, it might not work. The next model is kind of a hybrid model where providers offer concierge services on top of traditional Medicare or private pay insurance model. Now, this model only works if you evaluate your insurance contracts. What that means is that you need to ensure that you are offering services to patients that do not interfere with the contract that you sign. That means that if you're signed with Medicare or your private pay insurance and you're offering a service that is similar or exactly the same, you will be violating your contract if you tell your patients that they need to pay you cash for the same thing that their insurance is covering and you, who is signed with the insurance, is covering. So you really need to make sure that not only do you review it once, but you review your insurance contracts annually to ensure that you are not violating that agreement. Now, why is it important to review it annually? Well, Medicare and a lot of private pay insurance companies change the services that they offer every single year. So what wasn't covered last year might now be covered this year. So if you decided to add your concierge service model on top of an insurance model and you had a service that you were charging before, the next year you might have to eat that up in your insurance costs or eat that up with your Medicare costs. So you've got to be very, very, very careful. Another model that I've heard that people have done is they've said, okay, my practice is going to bill insurance, my practice is going to bill Medicare, but I am going to opt out of Medicare, or I'm going to opt out of the insurance claim, and the other providers in my practice are going to still be on insurance. This is not necessarily a model that I would recommend to any of my clients, only because it can get very tricky and very messy. And in my opinion, if your practice is covered under the insurance plan and program, I think it might appear that you're violating the law if you've got a contract with the practice and you as a provider are just deciding to not abide by the agreement, even if you have opted out. That's our opinion here, but some practices might think something else, but it's not something that I would suggest, because I just think it gets a little tricky and very dicey for the provider, and I think that you probably would be violating the law if you decide to do that. Now, what if you've already have contracts with your insurance company and you would like to jump into a concierge model? Here's what you should do. Number one, you need to go through you should go through your contract and make sure you have a firm understanding of the services that Medicare and the other private payers are charging. Get that list for 2023. Then designate the services that you can add to your practice that are not covered in that list for 2023. Then you need to make your Medicare or your other private payers aware of the services that you are going to be charging that are outside of the contract. You do not want them to feel like you're trying to do something that is going to breach their agreement. Then you need to draft agreements for your patients so that your patients now have a firm understanding of what you're trying to do. Your patients need to consent to the additional payments, and they also need to be told that they will be billed for Medicare or private payers for things that are covered under the contract. After you do these two pieces, you need to make sure that, again, you annually review it every single year and amend your agreements with your patients and potentially with your private pay insurance companies to make sure you're not violating the law. Now, here's what I told you. There are many different types of models that people try to adhere to when they're thinking about doing concierge practice models. However, some of them might violate the law and some of them are in line with the law. So you got to be very careful when you're trying to start this practice model. It's imperative that you talk to your patients and your patients have an understanding of what you're going to be charging, especially if you're going to be charging them additional fees. Your patients need to consent to these fees. Otherwise, you're going to have a lot of problems. Now, if you are thinking about starting a concierge practice, reach out to us at DorisMeet.com.